Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Can Anoro Ellipta and Advair be used together? Do not use Advair, fluticasone propionate and salmeterol inhalation, in combination with Anoro Ellipta, umeclidinium and vilanterol, as both medications contain a long-acting beta-agonist, LABA, and the combined use may lead to a risk of dangerous overdose. Only use the Advair or Anoro dose prescribed for you by your doctor. Both Anoro and Advair are used for the maintenance treatment of patients with chronic obstructive pulmonary disease, COPD. Advair is used to treat asthma. Excessive or combined use of long-acting beta-agonists, LABAs, like salmeterol or vilanterol may lead to serious heart risks and possible death. Examples of other LABAs include salmeterol, formoterol, fumarate, arformoterol, tartrate, and indacaterol. Combining beta-agonists medications may lead to fast heart rate, tachycardia, elevated blood pressure, irregular heart rhythm. Discuss these side effects with your doctor. Tell your doctor if you have a history of high blood pressure, abnormal heart rhythms or heart disease. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.